was reading different opinions on this, and there was one piece in Stat News by Dr. Jake Scott, who is an
Yeah, Jake Scott, by the way, is the guy that embarrassed himself in the Ron Johnson hearings. Jake Scott is a notorious vaccine industry shill.
Okay. Yeah, so he's an infectious disease physician and clinical associate professor at Stanford.
Stanford, but he testified that he had lost hundreds of patients to SARS-CoV-2, which is not the experience of the physicians that I've been working with. Jake Scott's clinical acumen and his scientific acumen, he really embarrassed himself with the claims that he had made regarding the data supporting vaccine safety and effectiveness at the Ron Johnson hearings. Aaron Siri basically methodically took him apart. And then he accused me of promoting hate against vaccine advocates and CDC personnel because I had published in Substack 2 memes on Friday and Sunday that had some reference to Elizabeth Warren's statement that you don't need 20 rounds to be a good hunter. And the counterpoint was you don't need to disarm you don't need to disarm the populace if you're a good leader. And Senator Blumenthal suggested that, and the other one that I published was a revolver with one bullet in the chamber that said that I think it was so a 6-shooter. 5 out of 6 scientists all agree that Russian roulette is safe. It was clearly a meme based on the statistics of a rare event that has catastrophic consequences, but both Jake Scott and the senator asserted that this was Robert Malone promoting violence against vaccine advocates, I guess like Jake Scott and the CDC. So Jake Scott is just not a credible player. He is a total vaccine shill.
Okay. So I was reading Dr. Jake Scott's piece in Stat News, and he on the U.S. shifting their vaccine schedule to match Denmark's. And to be honest, I was pretty unconvinced by his piece. But he went from virus to virus, explaining the rationale for different vaccination schedules. And his point essentially about Denmark is that he said Denmark has universal healthcare, greater access to healthcare, which the U.S. does not, and so you can't really compare it. And then he continues to say that
that argument was floated by. So basically, what he's doing is he's recapitulating the arguments that were made by the various medical guilds during the ACIP meeting. But think about it. What is he saying there? What data are there to support? He's basically picking out the differences between the U.S. and Denmark and saying, well, that makes it so that this logic of reducing the complexity of the vaccine schedule has no merit. But where are the data to support that? I mean, he's criticizing ACIP for absence of data, but basically all he's doing is promoting an emotional argument.
Yeah. And then he goes on to make more specific, quasi arguments, at least, about children being primary drivers of influenza, and so vaccinating them not only protects the kids, but also.
Where's the data, Jake, showing that? Yeah. I mean, what he's doing is he's throwing up the argument style here. The debate style is called straw man.
Yep.
He's throwing up straw men and then knocking those straw men down, but they have no merit. There's no data to support what he's saying. It's just throwing, spaghetti on the wall.
Yeah. I'll just quote a couple more sentences from him. He says, even with universal coverage, Why accept tens of thousands of preventable hospitalizations when we have the tools to prevent them? Why watch infants struggle to breathe with RSV when we can prevent it? Why wait for the rare but devastating case of meningococcal? I'm going to totally mispronounce that.
Yeah, meningococcal.
Meningococcal purpura fulminanis when vaccination can stop it all from happening.
The answer is, Jake, because the state does not have the right to mandate medical procedures on the citizens. That is the fundamental issue here. Jake Scott is advocating a utilitarian socialist argument that the state has the right to mandate medical procedures for its citizens. And the president disagrees. Bobby Kennedy disagrees. I disagree. If somebody chooses,
and the American people seem to disagree with that very strongly.
I agree. So if we provide parents or adults with the information documenting vaccine effectiveness and safety, if that information is sufficiently compelling, they will accept the products. In Denmark and Sweden, I believe, and many of the Nordic countries, there are no vaccine mandates. They have great compliance with their recommendations, but they're not mandated. Why? Because the people have confidence in public health in those nation states. And you don't build confidence by mandating people receive a injected product. You build confidence by providing them the information and allowing them to make an informed decision themselves. This is called respect. And if you don't treat people with respect, generally they tend to rebel and become, in this case, non-compliant. And so Jake seems to think that he and the state have the right to tell you what your child has to be injected with. And that is right at the crux of what's going on here, is that under the new administration, people have the right to self-determination. And they have, if they choose to accept a product and they choose to accept it for their children, and their children get an adverse event, well, they have been informed and they have made that choice. If they choose not to get the product and their child, for instance, develops a infectious disease, then that's their burden also. This is the way things are in classical liberalism and in a open, free democracy, not the socialist, Marxist, utilitarian logic of the state enforcing the greatest good for the greatest number. That is not acceptable to many of us. And as far as I'm concerned, Jake Scott needs to get a clue. If these vaccine products work so great, then herd immunity is not the real issue here. If they work so well, then if you accept the product, you should be personally protected. Now, let me give you an example of that. The mandate has been that all children receive tetanus, diphtheria, and acellular pertussis vaccines, Tdap. The WHO mandated that separate tetanus vaccines shall no longer be available, only the combination product, so that it will force people, particularly in Africa and emerging economies, to get vaccinated against diphtheria and in particular acellular pertussis. So let's look at that. And this, of course, relates to the issue of cocooning, the idea that people shall not, grandparents, uncles, aunts, shall not be allowed to come into contact with newly born children if they have not recently been boosted with all their vaccine series. This is something that the ACIP endorsed years ago without any data. And there's a notorious advertisement that was put out, presumably by the industry, that Aaron Siri got taken down, in which, to scare the public, what was presented was a scene in which a mother is passing a newborn onto the grandmother, and the grandmother, presumably infected with pertussis, her head transforms into that of the big bad wolf. But here's the thing. Acellular pertussis vaccine does not prevent against infection and spread. All it does is it minimizes the symptoms. So just like the COVID vaccine, it doesn't prevent you from being infected. And in the case of acellular pertussis, there's abundant literature that shows that what happens is it creates carriers that aren't aware that they're infected with pertussis, and they actually become more likely to transmit pertussis to community members and presumably other children, and such as infants. So this policy of advocating for vaccination with acellular pertussis actually increases risk for children. Okay, so, but yet that's a mandated product. Does that make sense? No, it doesn't. It absolutely is not science-based. And it's got to stop. This policy of advocating for, I'm using the example of cocooning, tears families apart. Grandparents are told, no, you can't come anywhere near this newborn, and uncles and aunts. And so the normal process of families coming together to celebrate a new birth is prevented. It further isolates parents from the extended family. It's just wrong. It causes all kinds of problems. It has no basis in science. But that is what people like Jake Scott advocate for. That is explicitly advocated for by the American Academy of Pediatrics, that policy.